Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing psychiatric medications, NCLEX nursing questions and answers. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 40-year-old female with schizophrenia is started on Clozapine after failing multiple antipsychotic trials. On day 10 of therapy, she reports fatigue, sore throat, and fever. Which is the most appropriate nursing action? A. Reassure her that flu-like symptoms are common side effects. B. Instruct the patient to increase oral fluid intake and rest. C. Notify the healthcare provider and prepare for a stat CBC. D. Encourage the patient to continue medication to maintain therapeutic levels. Correct answer, C. Rationale. Clozapine can cause agranulocytosis, a potentially life-threatening complication. Early symptoms include sore throat, fever, and malaise. Why correct? CBC monitoring is essential to detect neutropenia. How it helps? Early detection prevents sepsis and fatal complications. Question 2. A 28-year-old patient with major depressive disorder was recently prescribed fluoxetine. Which patient statement requires immediate follow-up? A. I've been sleeping a lot more since starting the medication. B. Sometimes I feel like it's not worth being alive anymore. C. It's been 5 days, and I don't feel any better yet. D. I get mild headaches, especially in the morning. Correct answer, B. Rationale. Self-harm ideation, particularly in young adults, can worsen during the initial weeks of SSRI treatment. Why correct? This is a safety risk that requires immediate mental health evaluation. How it helps? Prevents self-harm and initiates timely intervention. Question 3. A 33-year-old male with bipolar disorder is taking lithium. His current serum lithium level is 2.3 milliequivalent per liter. Which assessment finding requires immediate action? A. Fine hand tremors. B. Increased thirst. C. Slurred speech and confusion. D. Mild nausea. Correct answer, C. Rationale. A lithium level above 2.0 milliequivalent per liter indicates moderate to severe toxicity, with neurologic symptoms such as confusion and slurred speech. Why correct? This finding is life-threatening and indicates toxicity. How it helps? Prompt recognition prevents seizures, coma, and renal failure. Question 4. A patient taking phenelzyne, a MAOI, for treatment-resistant depression arrives at the ER with severe headache, palpitations, and photophobia after eating aged cheese. What action should the nurse take first? A. Place the patient in a dark, quiet room. B. Obtain a full dietary history. C. Administer oxygen via nasal cannula. D. Check vital signs and prepare for antihypertensive administration. Correct answer, D. Rationale. MAOIs like phenelzyne can trigger a hypertensive crisis when combined with tyramine-rich foods. Why correct? The patient's symptoms indicate acute hypertensive crisis. How it helps? Immediate BP control prevents stroke or cardiovascular collapse. Question 5. A nurse is caring for a patient newly prescribed Quetiapine for schizoaffective disorder. Which of the following labs is most important to monitor? A. Hemoglobin A1C. B. Serum sodium. C. Urine-specific gravity. D. Creatine kinase. Correct answer, A. Rationale. Atypical antipsychotics, including Quetiapine, are associated with metabolic syndrome and increased risk of diabetes. Why correct? A1C monitoring detects early glucose intolerance. How it helps? Prevents long-term complications like neuropathy and cardiovascular disease. Question 6. A 55-year-old patient on valproic acid for bipolar disorder is admitted for lethargy, abdominal pain, and vomiting. Which lab value is most concerning? A. Platelets, 180,000. B. Alt, 75. C. Ammonia, 142 micrograms per deciliter. D. WBC, 9000. Correct answer, C. Rationale. Valproic acid can cause hyperammonemia and hepatic toxicity, leading to encephalopathy. Why correct? Elevated ammonia is life-threatening and requires immediate evaluation. How it helps? Guides urgent treatment like stopping the drug and starting lactulose. Question 7. A patient with generalized anxiety disorder taking Buspirone reports no improvement in symptoms after 3 days. What is the most appropriate nursing response? A. You should stop taking the medication if it doesn't work. B. Buspirone can take several weeks to be effective. C. We should call the provider to increase the dose. D. Try taking it only when you feel anxious. Correct answer, B. Rationale. Unlike benzodiazepines, Buspirone has a delayed onset of action, 1 to 2 weeks. Why correct? Patient education promotes adherence and realistic expectations. How it helps? Supports therapeutic benefit and prevents premature discontinuation. Question 8. A nurse is teaching a patient discharged with Risperidone for psychosis. Which instruction is most important to prevent a life-threatening complication? A. Change position slowly to avoid dizziness. B. Report signs of a sore throat or fever immediately. C. Avoid driving until you know how the drug affects you. D. Take it with food to avoid GI upset. Correct answer, B. Rationale. Risperidone can cause agranulocytosis, which requires prompt recognition of infection signs. Why correct? This prevents complications like sepsis from neutropenia. How it helps? Ensures early treatment and prevents hospitalization. Question 9. A 19-year-old male is admitted with tremors, agitation, and hallucinations after abruptly stopping alprazolam, which he has taken for 2 years. What is the nurse's priority intervention? A. Orient the patient frequently to reduce hallucinations. B. Prepare to administer a benzodiazepine per protocol. C. Offer fluids and a low stimulation environment. D. Reassure the patient that withdrawal symptoms are temporary. Correct answer, B. Rationale. Abrupt cessation of benzodiazepines can cause severe withdrawal including seizures. Why correct? Readministering a benzodiazepine prevents complications. How it helps? Reduces risk of seizures and stabilizes the patient. Question 10. A patient is being started on sertraline. Which of the following patient statements indicates the need for further teaching? A. I may not feel better for a few weeks. B. I can take this medication with food if it upsets my stomach. C. It's okay to take St. John's wort with this to help my mood. D. I should report any thoughts of harming myself. Correct answer, C. Rationale. Combining SSRIs like sertraline with St. John's wort increases the risk of serotonin syndrome. Why correct? This is a potentially life-threatening interaction. How it helps? Education prevents serious complications and supports safe self-management. Question 11. A nurse is reviewing discharge instructions with a patient newly prescribed venlafaxine for generalized anxiety disorder. Which statement by the patient indicates a need for further teaching? A. I'll take this medication around the same time every day. B. I might have increased blood pressure while taking this. C. I can stop taking this medication if I feel better. D. It may take a few weeks before I feel the full effect. Correct answer, C. Rationale. Venlafaxine and SNRI should not be stopped abruptly due to risk of withdrawal symptoms. Why correct? This reveals a dangerous misunderstanding of medication adherence. How it helps? Prevents withdrawal effects like anxiety, dizziness, and electric shock sensations. Question 12. A 68-year-old patient taking amitriptyline for depression reports confusion, dry mouth, blurred vision, and urinary retention. Which nursing action is the priority? A. Document the findings and reassess in 4 hours. B. Hold the next dose and notify the provider. C. Encourage fluid intake to improve urinary output. D. Administer an anticholinergic antidote. Correct answer, B. Rationale. These are signs of anticholinergic toxicity, which is more common in older adults on tricyclic antidepressants. Why correct? Stopping the drug and notifying the provider prevents worsening toxicity. How it helps, promotes timely intervention and patient safety. Question 13. A nurse is assessing a patient on haloperidol who is experiencing muscle rigidity, high fever, and confusion. Which action should the nurse take first? A. Apply cool compresses and monitor temperature. B. Prepare for IV fluid administration. C. Notify the provider immediately, suspect neuroleptic malignant syndrome, NMS. D. Administer PRN lorazepam for anxiety. Correct answer, C. Rationale. This patient shows signs of neuroleptic malignant syndrome, a life-threatening adverse reaction to antipsychotics. Why correct? Requires emergency discontinuation of the drug and medical intervention. How it helps, prevents progression to rhabdomyolysis, renal failure, or death. Question 14. A patient taking bupropion for depression and smoking cessation reports a past history of a traumatic brain injury. What is the nurse's priority action? A. Encourage the patient to monitor for self-harm thoughts. B. Notify the provider of the patient's seizure risk. C. Monitor for insomnia and restlessness. D. Educate about avoiding alcohol while on bupropion. Correct answer, B. Rationale. Bupropion lowers the seizure threshold and is contraindicated in patients with a history of TBI, seizures, or eating disorders. Why correct? Prevents a potentially fatal seizure event. How it helps, allows provider to consider safer alternatives. Question 15. A nurse is preparing to administer IM fluphenazine decanoate to a patient with schizophrenia. Which action should the nurse take? A. Administer the medication via the Z-track technique. B. Massage the injection site after administering. C. Mix the medication with lidocaine to reduce pain. D. Shake the vial vigorously before drawing up the medication. Correct answer, A. Rationale. Fluphenazine decanoate is an oily, long-acting depot antipsychotic that must be administered deep IM using the Z-track method to prevent leakage and irritation. Why correct? Ensures proper drug absorption and reduces skin complications. How it helps, increases medication efficacy and patient comfort. Question 16. A nurse is caring for a patient receiving paroxetine for panic disorder. Which side effect requires immediate reporting? A. Weight gain. B. Sexual dysfunction. C. Bruxism, teeth grinding. D. New onset restlessness and confusion. Correct answer, D. Rationale. These symptoms could signal serotonin syndrome, especially if confusion and agitation are present. Why correct? Early recognition is crucial for stopping the drug and starting supportive care. How it helps, prevents progression to seizures, hyperthermia, and death. Question 17. A patient recently started on lorazepam for acute anxiety shows signs of sedation, slurred speech, and unsteady gait. What should the nurse do first? A. Call for a stat blood benzodiazepine level. B. Instruct the patient to rest in bed until the symptoms subside. C. Assess respiratory rate and oxygen saturation. D. Reorient the patient and raise side rails. Correct answer, C. Rationale. Benzodiazepine overdose can lead to respiratory depression and requires immediate assessment. Why correct? Respiratory compromise is life-threatening. How it helps, guides further intervention, such as flumazenol administration. Question 18. A nurse is teaching a patient taking aripiprazole about side effects. Which symptom should the patient report immediately? A. Restlessness or pacing. B. Mild nausea. C. Headache. D. Trouble sleeping. Correct answer, A. Rationale. Akathisia, a form of extrapyramidal symptom, can present as restlessness or an urge to move and may be distressing or lead to non-adherence. Why correct, may require a dosage change or additional medication. How it helps, improves tolerability and prevents early discontinuation. Question 19. A patient taking carbamazepine for bipolar disorder presents with a fever, sore throat, and a WBC of 2000. What is the nurse's priority action? A. Instruct the patient to take acetaminophen for the fever. B. Hold the next dose and notify the provider. C. Encourage hydration and reassess in a few hours. D. Prepare for a chest X-ray and sputum culture. Correct answer, B. Rationale. Carbamazepine can cause aplastic anemia or agranulocytosis, which may present with leukopenia and infection. Why correct, holding the drug prevents further bone marrow suppression. How it helps, enables early treatment and avoids fatal complications. Question 20. A nurse is caring for a patient on long-term benzodiazepine therapy who is scheduled for a colonoscopy tomorrow morning. What should the nurse do? A. Instruct the patient to stop benzodiazepines 24 hours before the procedure. B. Notify the provider and clarify medication orders. C. Tell the patient to take a double dose after the procedure. D. Reassure the patient that benzodiazepines will not interfere with the test. Correct answer, B. Rationale. Abruptly stopping benzodiazepines in a patient on chronic therapy can lead to withdrawal or seizures. Why correct, coordinating with the provider ensures safe continuation or tapering. How it helps, prevents withdrawal while maintaining procedural safety. Question 21. A nurse is caring for a patient with PTSD prescribed prazosin. Which assessment finding indicates the medication is having the desired effect? A. Decreased blood pressure. B. Reduced nightmares during sleep. C. Increased appetite. D. Improved attention and focus. Correct answer, B. Rationale. Prazosin is an alpha-1 blocker used off-label to reduce nightmares associated with PTSD. Why correct, it directly addresses one of the hallmark symptoms of PTSD. How it helps, promotes restful sleep, which supports overall emotional recovery. Question 22. A patient taking sertraline and tramadol presents with agitation, tremors, hyperreflexia, and a temperature of 103 degrees Fahrenheit 39.4 degrees Celsius. What is the nurse's priority action? A. Administer acetaminophen for fever. B. Apply ice packs and cooling blankets. C. Notify the provider and hold both medications. D. Encourage fluid intake. Correct answer, C. Rationale. This is serotonin syndrome, a life-threatening drug interaction often caused by serotonergic drugs, SSRI plus tramadol. Why correct, holding both drugs and notifying the provider is the safest and most immediate action. How it helps, prevents worsening symptoms and initiates prompt treatment. Question 23. A 35-year-old female taking lithium reports excessive vomiting and diarrhea for the past 24 hours. What should the nurse do first? A. Encourage oral rehydration. B. Hold the next lithium dose and notify the provider. C. Administer antiemetics as prescribed. D. Schedule serum lithium level for the next morning. Correct answer, B. Rationale. Vomiting and diarrhea can cause dehydration, increasing lithium reabsorption and risk of toxicity. Why correct, holding the dose and notifying the provider is essential to prevent severe toxicity. How it helps, allows timely lab monitoring and medication adjustments. Question 24. A patient with schizophrenia is prescribed olanzapine. Which dietary teaching should the nurse prioritize? A. Avoid high-fat meals to reduce GI upset. B. Eat tyramine-free foods to avoid interactions. C. Monitor your weight weekly and avoid excessive sugar intake. D. Increase protein intake to build muscle mass. Correct answer, C. Rationale. Olanzapine is associated with significant weight gain, hyperglycemia, and dyslipidemia. Why correct? Dietary education reduces metabolic side effects. How it helps? Promotes long-term medication adherence and health maintenance. Question 25. A patient taking clomipramine for obsessive-compulsive disorder reports dizziness and a recent fall at home. What should the nurse do first? A. Educate the patient about avoiding alcohol. B. Assess orthostatic blood pressure readings. C. Recommend using a cane for walking. D. Schedule a follow-up with the provider. Correct answer, B. Rationale. Clomipramine, a tricyclic antidepressant, TCA, often causes orthostatic hypotension. Why correct? Falls are a safety risk, assessing blood pressure can confirm the cause. How it helps? Guides interventions like dose adjustment or fall prevention. Question 26. A 52-year-old patient with depression is prescribed duloxetine. Which comorbidity would prompt the nurse to question this order? A. Chronic insomnia. B. Osteoarthritis. C. Uncontrolled hypertension. D. Diabetic neuropathy. Correct answer, C. Rationale. Duloxetine, SNRI, can increase blood pressure, and is contraindicated in uncontrolled hypertension. Why correct? Prevents complications such as hypertensive crisis or stroke. How it helps? Ensures safe pharmacological choices. Question 27. A nurse is reviewing discharge instructions for a patient starting lurasidone for bipolar depression. Which statement should the nurse include? A. You can take this medication with or without food. B. Avoid grapefruit juice while on this medication. C. This medication may cause excessive salivation. D. Take this medication with at least 350 calories. Correct answer, D. Rationale. Lurasidone must be taken with food, greater than or equal to 350 calories, to ensure proper absorption. Why correct? Without food, bioavailability is significantly reduced. How it helps? Ensures therapeutic levels and effective symptom control. Question 28. A 19-year-old patient on methylphenidate for ADHD reports weight loss and loss of appetite. What is the most appropriate nursing intervention? A. Encourage a high-protein bedtime snack. B. Hold the medication until appetite returns. C. Tell the patient to eat before taking the medication. D. Ask the provider to reduce the dose immediately. Correct answer, C. Rationale. Methylphenidate can suppress appetite, especially when taken before meals. Why correct? Eating prior to dosing helps maintain nutritional intake. How it helps? Supports healthy weight and medication adherence. Question 29. A patient taking ziprasidone for schizophrenia presents with dizziness and fainting. An ECG reveals a QT interval of 540 milliseconds. What is the nurse's priority action? A. Administer IV fluids. B. Hold the next dose and notify the provider. C. Encourage rest and hydration. D. Document and continue to monitor ECG. Correct answer, B. Rationale. Ziprasidone can prolong the QT interval, increasing the risk for torsades de pointes. Why correct? QT greater than 500 milliseconds is a medical emergency. How it helps? Prevents arrhythmias and sudden cardiac death. Question 30. A patient receiving IM haloperidol becomes rigid, diaphoretic, and unable to respond to verbal cues. Vitals: blood pressure 160/104, heart rate 130, temperature 104.5 degrees Fahrenheit 40.3 degrees Celsius. What is the nurse's first action? A. Notify the provider and prepare to give dantrolene. B. Administer acetaminophen and recheck temperature in 30 minutes. C. Apply ice packs and cooling measures. D. Reposition the patient and elevate the head of the bed. Correct answer, A. Rationale. This is classic neuroleptic malignant syndrome, NMS, a medical emergency. Why correct? Immediate treatment with dantrolene or bromocriptine is needed. How it helps: reduces muscle rigidity and prevents multi-organ failure.